Welcome to Cornerstone Care Teaching Health Center. We are a small program located in Mount Morris, Pennsylvania, which is in the southwest corner of Pennsylvania, about 10 minutes north of Morgantown, West Virginia. As a federally qualified health center and HRSA designated teaching health center, we treat patients from all demographics. So whether they have Medicare, Medicaid, if they're uninsured, commercial insurance. We also offer a slide fee program where patients can be seen at a discounted rate for both the visit and their labs, and we essentially don't turn any patient away. Our program is a very close-knit program that is diverse and family-friendly. Residents have raised families during their time here at Cornerstone Care. We also accept both U.S. and international graduates, as well as both MD and DO graduates.
So I have been with Cornerstone Care Teaching Health Center for 4 years, and during those 4 years we were able to develop interesting curricular activities, whether primary care research, quality improvement projects, and medical humanities. But whenever I think about what brings me to my work every day, it's the sense of family, the people who work here. I mean, I feel like I'm coming home whenever I drive to Cornerstone Care. I like the people I work with, the staff, the coordinators, and the residents.
I chose Cornerstone Care because it was clear to me from the beginning what a supportive environment it provides. So when I interviewed, I met different residents, and at the time, each one had a different lifestyle. They lived in different places around the area, and that really gave me a good idea that you can be anybody you want and still be able to be comfortable and blend in well in the program. It felt like it gave me a lot of encouragement because I moved from overseas, and I felt that, I could do this. It was good to see that the different residents were at ease, and they all seemed very happy with the choice they made.
So I chose Cornerstone Care because I really wanted a program that would prepare me to work in a family medicine setting, especially in a rural area, because I know that's what I want to eventually be doing. In addition, it was really important for me that I get some extra training in psychiatry as well, to not only focus on the patient's physical health, but also to focus on their mental and spiritual well-being as well. And I definitely get that in this program with our psychiatry clinics that we have. In addition, being a DO, I really wanted a program that had osteopathic recognition as well, to allow me to further enhance my OMT skills in my residency training.
We are an unopposed program where our residents do most of their rotations in Mon Health Medical Center and Washington Health System Green. The program has a 1-to-1 teaching faculty to resident ratio, so the residents have a great education both on the rotations and during the clinic here as well. And we also have a behavioral health continuity program. So residents develop patients in their continuity behavioral health clinics, and they see them throughout their 3 years and develop a relationship with them just like they would on the medical side, instead of the traditional 1 month of psychiatry.
Mon Health Medical Center has excellent reputation for top service, top quality, nationally regarded programs, but it's all physician-led. So you joining our team, you're going to help lead us into tomorrow. We're a 3-hospital system here domiciled in Morgantown, West Virginia, 50 sites of care from Elkins, West Virginia, all the way up to Hopwood, Pennsylvania. I think one of the best benefits of you joining us and being a resident here at Mon Health Medical Center in our system is you have the opportunity to really get your hands dirty with the doctors, with the nurses, with the advanced practice professionals at the bedside right here. The teaching environment here, I think, is excellent. I've been in large academic organizations. What I find different here, it's much more intimate. You're going to get to know your patients, partner with your doctors, be able to lay hands on the situation as it's developing to your scope and your expertise and your skill, but also be able to learn in an environment that's family-based, community-based, that's also superior when it comes to the level of clinical programs we offer.
We have great relationships with our attending physicians here. I've never felt that I was looked down on or judged for anything that I was thinking regarding a patient. I've never had any problems accessing them, even at home, via text message or call when I needed them.
They're always very interested in teaching. Even the specialist attendings make sure to tailor their teaching points in a way that we can actually apply in our primary care clinic. And so many of them are very easy to reach. A lot of the attendings would just tell you, hey, contact me anytime you have a question and I'll be more than happy to guide you. I chose Morgantown because while it sounds like a small town, it actually can behave like a city. It has everything you need and is pretty close to our outpatient clinic. I grew up in a city for most of my life, and I felt that I wanted to explore something new, and Morgantown provided that platform for me. It has just the amount of city that I need. It has a lot of small businesses that I love to support, so it really makes it fun to explore different things here.
I think it's a great place to live, work, and play. You have the best and the brightest. Your hours from Pittsburgh, your hours from Chicago, your hours from DC, you're 30 minutes from a state park. You have the university if you're into athletics. You don't have to go anywhere far to get the most urban, the most rural, and in-between experience. And you have excellent infrastructure for healthcare in North Central West Virginia.
Cornerstone Care has really made family medicine a very rewarding experience. It is very encouraging of continuity of care. So just the fact that I am able to see my patients more than once and to see that they love coming back to see me is what makes me feel I would do this all over again.